Hi, this is Dr. Donald Pelto, and I have a patient with me who had diabetes, and it's very interesting because a lot of my patients, they struggle, and I see them for diabetic foot care visits on a frequent basis, but I have a few of patients with diabetes that actually are able to do certain things to get off of their diabetes, such as changing their diet. And also there's a new type of gastric or stomach surgery that can be done. And I'm just going to have my patient kind of tell her little story about what she went through, why she chose the surgery, and really how it's changed her life and her diabetes.
Now?
Yeah, go ahead.
Okay. Well, I had diabetes, and I was seeing a diabetes specialist, and we tried different medications, and I was right at the edge where they were saying it might be that I needed to do insulin.
Okay.
And that scared me. So I had the gastric bypass surgery, and within a month after having that, my diabetes was gone.
So you were considered, are you still considered a diabetic, or you're considered?
They still consider me a diabetic because the numbers on the, I forget the letters that it is.
The A1C maybe? Or
Yes, that's the one. The numbers there, if it's 6.5, you're being watched for diabetes. If it's over that, then you have diabetes. And we worked really hard, and I'm down under six. I'm at 6.5 or under 6.5, and that's because it had started to creep up a little bit because I had gained some weight back, and the doctor was watching me, and he was telling me he was going to put me on medication again, and I said, oh, please, I don't want to do that again. So I lost 10 pounds, and it was just enough to move me back underneath the
6.5.
So he watches me, and I do my blood sugar in the morning, but I'm not taking any medication.
No metformin, nothing. And how long were you diabetic prior to this?
Years. It was years, because I got it right around when I turned 40.
Okay.
And I had this surgery 7 years ago.
Oh, so you've kept it for that long?
So it's been gone.
Wow.
And it was only last year that it went up. And then but also, to be fair, he had me have my blood test right after Halloween.
Okay.
So we don't do that anymore because that's not a real number. That's the only time of the year. And I was doing it at Easter, and those are the 2 times that I eat candy.
Yeah.
So we
And do you feel better after doing the surgery, or you feel like a different person?
Oh yeah,
Can you walk
definitely.
more?
I bought a house, and I would never have been able to take care of the house the way I was, because I lost like 100 pounds.
100 pounds.
Which isn't all that I wanted to lose, but it at least makes it so that I can function much better. And my blood sugar is down. My no more problems with my heart. Everything. I don't have any medications that have to do with health. All of my medications are just emotional stuff.
Now, did they encourage you to change your eating or walking or activity? How did that play in?
They suggest that you get a regimen as far as exercising, and they show you how to eat.
How to eat properly.
To eat, make sure you push the protein and vegetables. And I see a nutritionist every 2 months.
Oh, even after the surgery?
Yeah, in fact, I went yesterday.
Okay.
And I do that for myself for accountability.
Yeah, yeah.
So I still see my counselor that I was seeing while going through the program, and I still see my nutritionist every couple of months.
So what in terms of people that are listening to this that have diabetes, maybe they have foot wounds and things like that, at what time would you have, if you knew now, would you have done it earlier? Were you a candidate earlier? You know, in terms of doing it before the insulin, or even a couple of years earlier, would you have done it sooner?
I didn't know anything about it, and it was very scary because I went through the program for the bypass surgery.
They have a pretty
very strict program. There's a lot to it, and I went through it 3 times before I made the commitment to have the surgery because it was very frightening. But the fact that I was going to have to do the insulin, and the fact that they were looking at my heart was like too scary.
Yeah.
I needed to do something.
Oh, good. Well, thank you so much.